complete the pre-survey link prior to viewing this, you can see your email link or click the link below. What are we going to talk about today? Cystic fibrosis. Nursing staff and healthcare providers spend copious amounts of time with the CF cystic fibrosis patients and their families. As CF patients have lived longer lives, they have become more educated on all their complex disease management. In 2011, the median age of survival for CF patients in the U.S. was around 37 years and rising. CF is an autosomal recessive genetic disorder affecting a number of body systems, including the lung, pancreas, and sweat glands. As CF is the most common life-shortening genetic disease in Caucasian individuals, genetic testing is routinely available. All women who get pregnant will not have children with CF, as it is autosomal recessive in nature, and both parents must carry the gene. However, most males with CF will be. The basic defect is a disruption in the CF transmembrane conductance regulator, which causes a decrease in the chloride ion conductance, resulting in sweat that is high in sodium and chloride levels, and thick and viscous mucus. Clinical manifestations include GI symptoms such as insufficient secretion of digestive enzymes and malabsorption of nutrients and muscle wasting. In the lungs, the increased viscosity of mucus and its retention causes bronchial obstruction, recurrent or chronic infections, and eventual respiratory decline. Advances in dietary management have focused on an emphasis of higher fat diets and the use of acid-resistant pancreatic enzyme replacement therapy, thus contributing to better health, quality of life, and longevity. CF patients have higher energy requirements, up to 80% higher than healthy individuals, due to increased losses from fat malabsorption, increased demands imposed by the infection and inflammation, and a reduction in dietary intake. The dietary aim is to encourage a diet high in fat, greater than 40% of total calories. Proper nutrition and maintenance of healthy body weight can delay the progression of lung disease. CF patients should take pancreatic enzymes with all meals and snacks to help maintain nutritional status and prevent alterations in stool patterns. CF pancreatic dysfunction can lead to fat malabsorption, which predisposes patients to deficiencies of the fat-soluble vitamins A, D, E, and K. Thus, vitamin supplementation should be started as soon as CF is diagnosed, including in asymptomatic infants and in individuals without pancreatic insufficiency. CF patients are at greater risk to develop CF-related liver disease, small intestine bacterial overgrowth, diabetes, pancreatitis, and bone mineral disease. Retained purulent secretions are an important cause of airflow obstruction and airway injury in CF. Chest physiotherapy, CPT, in the form of postural drainage and percussion remains a pillar of CF pulmonary care. CF patients need to do CPT daily, even in times when disease is controlled and patient is asymptomatic. CPT can be performed alone, does not require formal assistance, and does not require the patient to remain in one fixed position. Aerobic exercise training in CF has been reported to improve or slow down the rate of decline of lung function and prevent recurrent lung infection. CF typically has a course of intermittent acute exacerbations where they are treated with antibiotics, oral, inhalation, or IV, depending on the infecting organism and the severity of the exacerbation. Antibiotics must be taken as prescribed and to completion to avoid resistance. Known viral infections do not require antibiotics. Short-acting inhaled beta-2 adrenergic receptor agonists are suggested for patients prior to inhalation of hypertonic saline, thus promoting mucus clearance. Antibiotics or initiating chest physiotherapy. Medications or drying up mucus secretions are not useful long-term. Delivery devices used for medications must be cleaned via sterilization at least once per week. Masks used for delivery of nebulized meds do not need to be kept 3 to 5 centimeters away from the face. Severe CF lung disease is the common indication for lung transplantation, and outcomes are better than those of patients undergoing lung transplantation for other indications. CF remains extremely debilitating. Many patients seek support groups and secondary resources to improve quality of life. Many are extremely educated on their daily needs and often find healthcare providers are less educated on the daily needs of disease. When hospitalized, patients must replenish their expertise and rely on professional experts to assume the role as this has created potential stigma of an expert patient. Hospitalized CF patients are not required to be isolated with other CF patients, both socially or physically, as different infections can easily spread between one CF patient and another. CF patients are required to be isolated from other CF patients. Medical staff must wear gowns and gloves when treating a CF patient to prevent the spread of CF-related infections. It is important to remember that CF patients continue to work, have families, and carry on their lives. As CF patients have lived longer lives, they have become more educated on all their complex disease management processes. We must identify any gaps in CF education, management, or the lung transplant process to improve both quality of life and survival. Please close this and complete the quick post-intervention survey now. Just click below or in the email. Please do not have this clip open during the post-survey, please. Thank you for your time and help. We hope you learned a few things.